There were a number of cuts this week to services for mental health and substance abuse.
The U.S. Substance Abuse and Mental Health Services Administration cut nearly $2 billion in grants, and it's being felt in many communities. Faith Zahowski spoke with some agencies that focus on mental health and substance abuse services. Faith, did they see this coming?
Kaylee, multiple people I spoke with say no, and that they had no idea these cuts were coming and that it would be so extensive.
There's never been a time in my 32 years of doing this kind of work in the prevention mental health field where we've ever seen this level of uncertainty.
Deacon Dazowski, president of Epiphany Community Services in Swanton, says the news was alarming.
There's a substantial loss of funding from this immediate termination that happened at 10 o'clock last night with zero notification.
Dazowski says the cuts from his Swanton-based business total about $500,000 a year. The firm's 3 locations provide mental illness and substance abuse support for anyone who needs it.
We fully anticipate the immediate economic ramifications of people losing their jobs. We don't think that agency is going to be able to be staffed up. There will be counselors that are no longer in schools anymore. There's going to be people at the other end of a helpline no longer there.
And he's not alone. Claire Morrow with the Zeph Center in Toledo says this cut is costing them $1.2 million. Morrow says this is jeopardizing programs that offer housing and quick access to substance treatment.
Honestly, it's going to be a devastating impact for not only our agency, but for the community. We have thousands of people coming through our doors at several locations every day.
Executive Director of the Mental Health and Recovery Services Board of Lucas County, Scott Silak, says he has no doubt the impacts will be felt immediately if people can't get these services.
There is the potential that people may die because of this, and that's how serious we take this. Every dollar we receive in this community is precious to the fight against alcohol, drug, and mental health disorders. The manner in which this happened is beyond an understanding as to why it would occur in this way.
Silak says he's not sure how this will impact services and if some programs will have to close if the money disappears permanently. The U.S. Substance Abuse and Mental Health Services Administration cited that the cuts were made to realign with the department's priorities, but did not clarify what those are. Reporting in studio, Faith Zahowski, WTOL 11.